Just a quick disclosure to share in conjunction with this podcast. Each of us are speaking to our personal experiences and do not consider ourselves experts and cannot offer medical, therapy, financial, or legal advice. We represent a wide range of experience on the autism spectrum and will always honor each perspective that is brought to our discussions. Our experiences, opinions, and perspectives are all unique and different and will be celebrated. Thank you so much for listening and connecting with us. Thank you. Hello, welcome back to Navigating Adult Autism. My name is Mary. I'm here with Cynthia, Dawn, Elizabeth, Heather, Tara, and Kara. And tonight's topic is healthcare and everything that encompasses from many different angles. I'm going to start off with either Heather or Elizabeth, and we're going to talk about our healthcare with our adult children with autism. One thing I do want to say that if you're questioning insurance coverage from the transition from pediatrician to adulthood, Obamacare at age 26, they're still covered under your insurance, that if one or both of your spouses is still working, your adult with autism, or any disability actually, after age 26 can still be covered. In Missouri, I think it's nationwide because it's a disability act, I believe, can still be covered under one of your insurance policies. So keep that in mind. A lot of people didn't know that.
I didn't,
and I learned from a friend of mine whose child has an adult child with cerebral palsy. And so our son is still covered. He's almost 32. He's still covered under our insurance. Listen, we're pushing retirement age pretty soon. So that will be a whole nother insurance issue in a few years. But if you're out there, just know that if you're still working, your adult with autism can still be covered under your insurance after age 26. So there we go. That's my little tip for the day.
It's a good one.
Yeah, it is a good one. It's an important one.
And kind of go along with that too, when we're talking, about the medical power of attorney. When do we choose that? And we haven't even done that because my son, one has guardian, but the one that we don't have guardianship over, it didn't really mean anything because he is very compliant with all his medical treatments. And it really is just giving you that permission to speak on his behalf, which if he's unable to, then it goes to you anyway as being, the next of kin. So it was really an interesting, to look at choice. So when you're looking at those, I would definitely look at some of that, look into that a little bit. Is it actually needed? And what kind of power does it actually have? You can do a lot of schedule appointments and do different things like that. But I don't know, our journey really with when we talk about health and medical, and one of the things that I've struggled with when looking with our pediatrician, and now we're looking for that adult, is my sons don't always have the same perception of pain. Even my older daughter doesn't have the same perception of pain, so it's really hard to identify those needs. And then once maybe they do identify, they don't know how to tell us. They know something's wrong, but can't really pinpoint it. So it's just been it's been a struggle. And when we've worked with pediatricians, those conversations were longer and they looked a little bit more, but I'm a little worried as we're an adult, are things that we could really spend some time digging at and looking at as a younger child with a pediatrician versus we're now an adult healthcare, and we need to get in, we need to tell him what's wrong, and we need to move on. For Chase, he was diagnosed with Crohn's at 12 years old, and when he was diagnosed, he was 50 pounds, he was about 50, he dropped under 50 pounds. He was so skinny, and we did every test we could, and then when we finally ended up doing the tests for Crohn's, they came back after the test and they said, I can't believe your child's even walking. He should be in excruciating pain. And yet he never displayed any pain to us. So we didn't know, was he not perceiving it? Was he feeling it? Not, and that was just the norm. He didn't understand.
It's the high pain tolerance that we have with autism.
Yeah.
It's kind of a known aspect.
A quick story about his his diagnosis, though. I took him in at 12 and he got in his gown and everything. It was time for the colonoscopy. And I said, he got his gown on and he's like, okay. I said, Chase, underwear too. And he was like, looked at me, he goes, his head snapped and he was like, where are they putting that camera? And I said, yeah, honey. And then I quickly said, it's the size of like a pencil eraser. Because I immediately imagined he was thinking this huge camera. Yes. So we had to clarify that. But we're still just at the beginning of transitioning. We've got some adult appointments made. We've lost just recently, even though Nathan was 21, because I had the brothers, they kind of kept Nathan. But we have not made that general practitioner appointment. We've got some specialists coming up where we are moving to adult. We have moved to adult neurology with Nate. And it was different. They're not gonna, they don't coddle you anymore. They don't, So I would like some advice from those of you that have gone through that, have made that transition to all the adult services.
I'm giggling. It wasn't very funny. We just went through this.
Did you? Go ahead.
I didn't find it very funny at all.
Not a good experience, Heather?
No,
we are not laughing.
No, we are not.
Zachary had a pediatrician that was wonderful. He left during COVID. He left the system and moved off to the East Coast or something. And he was awesome. And he had told us that he would see Zachary through until he started having adult issues. So I didn't feel like we had to go through that. And then he left during COVID and we got a letter. That's how we figured out, obviously. Yeah. And so then we were seeing somebody who wasn't used to us at all. I've been in healthcare for 18 years. I mean, I just retired from it. And I can tell you that there's lots of physicians that, aren't comfortable with this population. And especially when they can't tell you anything. When there's no verbal, back and forth, some of them just literally just don't know what to do. So it is hard to find somebody. So I remember we went to that last pediatrician visit and they're like, well, I guess we'll see ya. It was just like, good luck to you. And I was like, do you have anyone that you can refer us to? Like that, is great with people with autism or anything? And no, they couldn't.
Right.
And so it was like, well, okay, good luck. And I was pissed. Mm-hmm. Pissed.
Right.
I thought this system sucks. What in the world are you doing to us? Like we have, people with diagnosis, they need a doctor. Mm-hmm. We need that connection. We can't break that and not have a doctor for a year while we try to find somebody that's willing to see us. So I just went to parents. I went on social media and asked parents, and that's where I got the referrals that were actually helpful. And then, like Elizabeth said, I set up, 3 or 4 appointments. Did end up finding one that's wonderful, but he's also a parent, and I knew that going in. So I just did a little bit of research, and so that's been good. But I think in working in healthcare, I know that there's a ton of education that's needed. I know when we've gone to the emergency room, just it seems like, they might ask. So like when Zachary had his first seizure, we went to the emergency room. That was not pleasant. Mm-hmm. They didn't even know, like, if he can't talk to you, why don't you talk to me? Like, I'm here, I'm his mom. I can tell you pretty much, but they would say, well, can he even, like a procedure that they might do all the time with somebody that didn't have a disability, right? They're saying, well, can he even do it? And it's like, well, does he need to do it? It's this conversation that I have with professionals a lot. Mm-hmm. It's like, would anyone else need this? Like, if you've had a seizure and you've hit your head and you've got blood on your head, would you look at their head? And if the answer is yes, then I guess we're going to get Zachary in that machine. We're going to get it done. Mm-hmm. That's right. If I have to suit up and go in, be glad to help and do that. But to think that they can't have the same level of care as the typical population, like when they have incidences and stuff, it's totally unacceptable. Is what it is. So I think there's just a lack of training and resources possibly for them. Elizabeth, you might have done some training in that area. I don't know, but
Yeah,
We might need to sign you up to go to a few more places.
Wouldn't mind. Done a lot of first responders, firemen,
Yes,
policemen,
yeah.
have done all those. But yeah, not so much in the healthcare. And that, as you're talking, it just reminds me, we have moved to the adult the services for Nathan's monthly IV treatment. So on top of his autism diagnosis, he also has autoimmune encephalitis. So he needs this IV treatment, so IVIG, where he's getting the immunoglobulins. And when we did children's for years, and it was hard. The IV itself, once it was placed, it was not hard, but getting it in was hard, and they worked really hard and supported him. We moved to the adult, and they're like, well, we can't restrain him. I mean, they kind of helped a little bit, but quickly backed off there as soon as he resisted. They're like, well, we can't hold him.
Mm-hmm.
And I'm like, well, I can't hold him.
Mm-mm.
And it quickly got out of control. They used a different type of needle the first time, and it set us up for failure. Then he got a hematoma one time, his arm and so his last treatment was like in November, and right now his symptoms are getting out of control because he hasn't had this treatment to help his brain swelling. And I don't know what we're going to do.
Why couldn't they hold him, Elizabeth? Why couldn't they hold him down?
They said that's not their policy. Mm-hmm. They won't hold him as an adult. As a child, they would help. I gave permission, even though I'm his guardian, and that's I'm going to go fight that. And they just and the nurses themselves they did work hard. They didn't just dismiss us, and they would try for hours to talk him into it. But and really the needle itself he didn't used to be afraid of the needle. He just couldn't hold still. And so we held him. Usually he'd really relax and take a breath, and the needle would go in, and that would be it. No problem. And then we were there for, the duration of the treatment. But now he's terrified of the needles, and he'll run, and he'll try to get away, and he'll scream, and he'll use his head to push away. And it's traumatizing, and we've had to stop. And, we thought, well, maybe this is the end of the treatments. But as his symptoms have gotten so intense, we're not sure what to do. We're just not. We've called it. I've been in contact with an ABA therapist. We're looking at, could we do it at home? I know, it's been suggested for a port, but I don't even know how the port works. So do they still take a needle then?
Mm-hmm. Mm-hmm. So you can put some rubbing cream. You can do it's a lidocaine cream that they put on it and about an hour before, and he will barely even feel anything.
And see, that's the thing.
And that's even something for your arm. You can use it's a prescription you pick up, and you put it on that area an hour before, and they'll barely even feel it poke.
And that is where that lack of training comes in.
Correct.
Why didn't we know that?
Right.
Why didn't somebody in the pediatrics, as we're holding him, why didn't they say we can do this before he was afraid of the needle? And so, and somebody had mentioned that, and I was like, oh, I bet they could. But I'm like, I think it's too late. Hopefully we can backtrack and retrain him. But I think we missed that, and I'm not sure how we're going to do it. But yeah, if we had numbed him, because really the problem in the beginning was just
seems like a no-brainer.
Yes. Well, and he changed something there at the hospital because it would they get all the tape on him, right, to hold the IV in place because, he just didn't like to hold still. That was the issue. And then it took 45 minutes to get the tape off of his arm because he couldn't stand it. So they, were able to get approved to get this nonstick tape. And now all the hospital, a lot of that, they enjoy that because somebody said, well, this is his problem. Let's fix it. Mm-hmm. And that was amazing. So why didn't anybody else step up to the plate and say, well, there's this thing. Let's put this numbing on his arm. We're going to take one of those barriers away. Mm-hmm. So now I'm just scared.
Mm-hmm. Wow. Sorry about that.
Me too.
That's unfortunate, to say the least.
Yeah.
Sounds like you need to be in the ER doing training and the doctor's offices, Elizabeth, in all your spare time.
Yeah.
Collect parent stories of failures and do a Reader's Digest condensed.
I think
here was the problem, how it wasn't addressed, but eventually,
It seems like
This
if they
was-
have a connection somehow, and this is across the
Yeah.
board, whether it's a
Mhm.
speech therapist
Yes.
or like if they have connections to and understand a little bit or know somebody that has autism or another disability, then they're better. I mean, I can think of the positive times that we've had. They've all been almost all parents
Right.
or a family member. Like I remember meeting somebody in urgent care one time, and we still stay in touch with her. She was so nice.
I love that.
You know, because they either want to try to figure it out or they don't want to touch it. You know what I mean?
Yeah.
It's like,
Yeah.
Zachary was just in the ortho urgent care because he hurt his foot, and they were very kind. The doctor was like, "Can he tell me anything?" And I said, "Well, he can tell you foot," which we all knew it was his foot because he wasn't putting any weight on it. But he couldn't tell him how and then what part of the foot. So the doctor just kept asking, kind of looking at me, and then in the end, I said he has a super high pain tolerance. So if he's not walking on it, I can't even imagine what it feels like. But he was really gentle and kind with him, and then just kept kind of touching his foot and then watching his facial expressions. Like that's how he figured it out last week. When
That's good.
we went. So that was really nice. That didn't happen all the time, but
Right.
it was good.
How do you think Zach hurt his foot?
He hurt his foot because he stomps. He's
Self-stimulatory behavior.
oh Lord, he stomps his right foot on the hardwood floor like it's deafening. I'll tell you, I can handle lots of stuff. This is the hardest season of this type of thing that we've had with him because it's so loud, and he wakes up 3 a.m. and does it, and but he just pounds his foot into the hardwood floor. So he did it, to himself. I'm hoping that he'll correlate like I shouldn't do this because it'll hurt, but I'm not sure if that's going to happen. We're hoping that he'll understand the connection to it. But anyway, it was a good medical visit this time.
And when
for
you
sure.
posted that on Facebook, there was another autism mom who said her son used to bang his head.
Yes.
And the doctor said, well, once he realizes it hurts, he'll stop.
Right. And that's not the,
No, he's not probably going to.
No,
Right.
I mean, there's not always connection between
That
any of
doctor
this stuff.
lack of education.
Right.
Yeah.
Yeah,
That
just not
doctor
knowing.
should have known that.
Yeah.
Should have known that. Out of Mike's, I'll explain on Kelsey, and about education and reaching out to the doctors that really truly get it is, right after Kelsey was diagnosed, we looked into the DAN protocol, Defeating Autism Now. That was the gluten-free, casein-free diet, therapies along with it. And back then we had nobody that was certified, and I didn't want to have to travel to go to a doctor. And I was like, and at that time I was in medical sales, and I caught on a lot of family practice doctors. So I got to brainstorm and thinking, okay, what doctor's open-minded? Dr. Maria Carter. And she was over on Battlefield, very open-minded. And I was like, okay, I had a good relationship with her. So I went in and I spoke to her office manager, and I was like, hey, do you think Dr. Carter would be interested in being trained on the DAN protocol? It would mean going away for training. And she goes, well, let's go down and talk to her. So she went down and we talked to her, and I explained to what it was. And I said, there's an upcoming training in California. She goes, well, let me look here in my book. That's, I'm going to be in Vegas that week. I could just jump on a plane and go over. And I was like, you know what, Dr. Carter, if you're willing to do this, I'll pay for your airfare and your fees to get into the conference if you're willing to do this. And if you agree to be my doctor when you come back. Or my daughter's
sign
doctor.
right here.
Yeah. And she goes, well, let me think about it. Let me think if I can, get this worked out. And so our office manager called me a couple days later. She goes, Dr. Carter really wants to do this for you. And I'm like, that's awesome. You just let me know what I owe. Do I need to pay in advance afterwards? Whatever it is. And she goes, we'll get back with you. So she came back and she really enjoyed the conference, met some really good doctors, some good resources, networked there, came back and started treating kids on the autism spectrum. And I had gone in to see her several times afterwards before she retired. And I can't remember how many autism patients she was able to treat after that by going to that conference. Yeah. So by reaching out to the right doctor and making sure that they get educated. You know, a lot of these doctors, they do want to help, and they just don't know, what's out there. So I think it's just going in and presenting it.
You had a connection
with her.
That helped.
And I knew she was open-minded.
Right.
And she was willing to add that additional training to her education to better treat her patients. And it wasn't just, and she had told me, she goes, Kara, it's just not the autism patients. I'm using these things on my other patients too. So.
But, that's the testament of what one parent can do. The impact you had,
Good point.
It's mind-blowing, really, to think of the impact you had on, by doing that one thing. And the numbers are so high. We need to start making those impacts.
Maybe we need to find that one doctor. That doctor could get so many patients, finding that one doctor.
Yeah.
Not that they really need it. Some of them are so overwhelmed anyway, but maybe a private practice doctor.
Well, like the developmental pediatricians as well, getting those in this area. So I'm not saying there aren't any, but I don't know. There's if there
or even
are,
a nurse
not
practitioner. It doesn't even be a doctor, a nurse practitioner.
Absolutely,
we need it.
Well, and back to the Dan doctor, you did say it. It was Dan is for Defeat Autism Now doctor, and I remember back in the day when everybody was gluten-free and casein-free, and now everyone's gluten-free. Yes. I'm like, you know what? We were that.
We've been there, done that.
We know all about that. Like, you all think, I'm gluten-free. Really? Well, listen, back in 1999, 2000, we already knew all that.
Yeah.
It helped make children speak, and right? That was the whole deal, is that it brought out language. So that was back in the day. So we were ahead of the game there. But anyhow, moving on. So... Cynthia, what about you?
We had pediatric neurology, and we did that in Springfield until we needed to leave Springfield, and we drove to Columbia because we had a really good doctor, Natel, in Columbia. Did you go to Columbia too? And Robin, his nurse, was wonderful.
Yes,
Columbia, Missouri.
Yeah.
Was this at the Thompson Center by chance?
It was at the Thompson Center.
Yep, Dr. Patel, who's diagnosed Chase with his epilepsy, first one.
And then from there, though, when he turned 18, he could come back to Springfield. And Kevin, his dad, had a neurologist that he loved. It was Dr. Rodney Quinn, which was the best in Springfield for a long time, and he retired. But we did get to go to him, and he was excellent. And then he retired about probably 4 years ago, and I forgot who he was referred to, but since he's been referred off, that doctor's already left Springfield now, so he's now on his third doctor.
Did you ever hit Backdash? Backdash was good.
I didn't. Yeah, I didn't have Backdash, but what clinic are you thinking of going to now?
So we actually had gone up to, they hit that, that was the one adult service, that we couldn't wait and postpone. So we had actually gone, out of town up to, because we thought we would go somewhere better, but we got up there and that was, I don't know if I shared this, it wasn't a very good experience. We walked in the door and he's the neurologist, so this is adult neurology. And obviously.
Where was this?
It was in St. Louis. It was one of the St. Louis hospitals. And so we thought, well, we're just going straight to the top. But we went in and very rude in checking in. We got into the doctor and the first thing he said is, I can't fix his autism. We're not here for autism.
Yeah.
And so I'm like, and it took us a while. He has epilepsy. He has seizures. We need adults to manage his medication.
Yes.
And it took a while to convince him we weren't there to have him fix his autism. I'm like, if it could have been fixed, we would have already done it.
Yeah.
And so we ended up coming back to Springfield because he put him on a medication. I think that would time, and I know Depakote works for a lot of people, but it caused seizures in Nate. He started having seizures daily. And so, and he just wanted to up the dose. He said, well, that's not enough. I'm like, well, he has a seizure every couple of, 10 to 12 days. And now he's having one and more than one in a day because he started this medication. And so we called into Springfield and I called around and, we found a neurologist that had I said, he's got to see somebody. And they said, we just had a cancellation, bring him in. Okay. And that doctor, he said, we're weaning him off the Depakote immediately. We can't just stop it. And we're going to start adding, the Keppra that he's on now. And that was a good experience. You know, that was
was
so,
good.
it really made me loyal to him, but still great guy, but he is still an adult practitioner, you know, because I'm like, okay, this time, last appointment, I want to learn more about his epilepsy. Because I have to know as much as I can because of his autism, he doesn't understand the safety precautions that he needs to take. He can't, you know, he's not getting these things, and I can't, you know, we're learning. He's learning because he'll stay in bed, you know, if he knows he's going to have one. But yeah, it was a completely different. But I was really thankful for him. But it's still a completely different experience.
Yes. And most of us have to travel sometimes out of Springfield to go to, especially for those of you who don't know. I mean, St. Louis, Kansas City, Columbia. That's also a little bummer, isn't it? I mean, that we have to travel, and we don't live in a big enough city to handle all the specialists. So that's wearing on families too.
Well, and sometimes, depending on the specialist, you want to travel.
True.
Because the doctors here are not very good. I'm not all the doctors. I'm just saying that there are some specialties that you do want to travel.
That's
Correct.
why we chose that first step. We just didn't get to the right destination.
Right.
So we backtracked. So.
Right.
Well, I think the pediatricians, in our experience, the pediatricians have been so good. It's like you just when
They spoil you.
Yeah, they spoil.
You're
they
right about
spoiled
that,
us.
Tara.
Yeah.
And we've tried a couple. Now we just sort of go to urgent care all the time. If something goes wrong, we don't even have Zion doesn't even have a doctor. So ever since we got the letter that probably the same doctor, the pediatrician, was going to
really,
treat them
anymore.
until they were 21.
Whenever you're sick, you can't get into your doctor.
Right.
You're only able to get into your family practice doctor for your yearly.
Yeah.
And to write your scripts,
Yep.
you know, to renew your scripts. But whenever you're sick, when you need it anymore, you can't get in that day or the next day. I mean, they're booking 6 months out. So they want you to go to the urgent care.
Yeah.
Maybe we need to hit the urgent cares
Well, and I think
and train.
I think so. Because my oldest, so Nicole, she has utilized urgent care living in a different state, and she has felt very taken advantage of financially and not listened to so I think, really going to the urgent care to do the training, I think it would be wonderful because she comes out with this huge bill and no answer.
Right.
And she's still sick or she's still miserable or she's still afraid because she looked, she's got a couple symptoms that could mean, how we all do, something that could really mean something, but maybe
And
not.
they can only do so much at urgent care.
Yeah.
I mean, at the Mercy clinics and stuff like that.
Yeah. I will say we transitioned our son to my husband and our doctor, which is an internist. And it was a very easy transition. And we do go every year, and we actually have a really good experience with him. He does call in meds for us all the time if we need them.
Good.
I never go to urgent care, especially if we show up every year for our checkup, and he's more apt to, which we do. I mean, especially because we're older now. But so I have a wonderful relationship with him, and he's probably going to retire soon. I don't know if he is, but that's worked out really great for us. So he knows our son very well and is good with him. I mean, I don't know what else to say. I'm worried when he leaves about finding somebody else, but I still think of what Susie with Ride for Ability still stuck with us about all those appointments they're going to have as adults, and we won't always be around, and how are they going to get there? And I have anxiety sometimes just thinking, did I tell him if I'll think of an over-the-counter medication, did I tell him not to take that? There's just so much that they don't have in their common sense book that they don't know how to, and I know, Heather, you're in a different boat too, but I know when our son is in pain, he has a very high pain tolerance. So if he tells us he's sick, we jump to high heaven because we know he's sick because he never complains. It used to be when he didn't feel good, I'm fine. Stop. And I'm like, oh, you have a fever, but yeah, when he's in pain. He recently had a sinus infection. He needed 2 antibiotics over the holidays, and they were called in lickety-split.
Wow.
And then in the future, he has actually a peer that he doesn't really hang out with, but it's someone he went to school with and friends with the family. And she is a doctor, and she's family practice with Cox. And hello, if you're hearing this now, I'm going to call her, but I think I want to put her in our trust and our will, so he has someone he knows
That help guide him.
can help guide him, so I'm just always trying to think of the future because you have to with our kids. It's not a typical situation. But I will say we're happy with our doctor for right now. We've had good luck. And so I've recently talked about his anxiety with him. And our doctor was like, no anxiety medicine right now. Let him be who he is. That can cause more problems. Like, just work on him, with some things. So I'm like, okay, I appreciate that. But so there are some good doctors out there, but
there are.
not a lot.
It's just hard to find them because
Very hard to find them here in Springfield. Yes.
word of mouth.
If you have
Yes.
your medicine, I mean, like Zion has a psychiatrist, so all of the medicine goes through that doctor.
Right.
So unless he's, physically sick, which is very rare.
Right.
But I do want to say that my child is not overly tolerant to pain. He complains all the time. So you guys,
It's the opposite.
yeah,
Let's
total
stop there.
opposite.
Is that attention-seeking behavior, or is he really in pain? There's
I don't know. He had a fever recently, and
Yeah.
he was, yeah.
And he might be because
Sure.
not because I know with Nicole, she's explained. She said, I can feel everything.
Yeah.
And even if it doesn't really hurt, and she's like, am I supposed to be feeling that?
exactly.
Does that mean something's wrong? Does everybody else feel that? Because it's with me constantly. So she's just as she's grown, and it's just recently been like, I can feel everything, and I never know when to worry.
It's
is
hard
this
for her to
is this
decipher
yeah, is this a sign that there's something more? Is this uncomfortable? Is it a sensory thing, or is there something wrong? So
That's me as
So
a mom, though, because he complains all the time. What do I take
Right.
seriously?
Mm-hmm.
It was like, I don't know if you have COVID. We have bought 100 tests for him because he has to be tested every single time. Anytime he has a cold, it's COVID. And I mean, he is all stuffed up. I mean, you could tell that he's sick. He's not just getting attention. I just think he feels everything. I don't know.
Yeah, I'm glad you brought that part of it up there, because that's kind of like the flip side of what I experienced with my sons. And yeah, it's different. It's different. It's very confusing for her as an adult, and then to go in to explain that, then the doctors think, yeah, you can't feel that, and they think she's there for attention, or she's exaggerating. And, she's like, yeah, I can't really feel that, because she'll feel something, and then later on it'll come true. And we're like, how did you know that so soon?
Yeah. Oh, yeah. Zion kept on telling me that his head was buzzing. Like he was getting buzzes in his head. And I just totally thought he was complaining. I was like, oh, whatever. You're not getting buzzes in your head. Like he said, it's like a bee buzzing, Mom. And we went to his psychiatrist, and he said it was a side effect of one of his drugs that they had increased it
That's
too
what
much.
I was just wondering.
And I was like, oh my gosh, I need to listen to you more. I was like, how horrible that you're getting this, shocking buzzing thing in your brain.
Poor guy.
And I didn't listen to him very, very quickly. I mean, he went like a week and a half with the buzzing in his head. And he was like, Mom, I think we need to
do something.
Yeah. And we called his psychiatrist, and he was like, oh yeah, we have to decrease that immediately.
Oh, wow. Yeah, there are side effects to medication.
Yeah.
Wow.
Well, I think if our listeners take one thing away today, I think that's going to be, that's going to be it. I need to not dismiss certain things, and it's hard. It's hard to know if it's attention, because that happens too.
It does. It does. It does. Yeah, it's tough, but I think we're good on healthcare then.
Good luck. I need a doctor.
A good one.
Yeah. Go to Mary's doctor.
Which I'm not going to say his name, because I'm afraid he's going to get inundated. But listen, I do believe in a good internist. That's their special. They're a specialty, but they went to a year more of school. But yeah, I don't know. I think because I had my mother-in-law's a nurse, and I've had family members that are nurses, and they just in our head like, get a doctor. Don't ever not have one. So I was like, okay, I'll do it. So.
Well, I will add, we had really good luck just for a GP, and it's at Health Tracks on Fremont.
Oh,
They're
okay.
really good there.
Oh, good.
Yeah.
Good.
And
That's
Dr.
good.
Bunbury, and he usually sees a PA, but he likes all of them. He likes to see Bunbury because her niece was in the zoo program. So
Oh, for Erica.
yeah.
I've been in Springfield a long time.
Mm-hmm.
Yeah. I remember Dr. Bunbury helped my son when he fainted at church.
Did he?
Yeah. Helped him. But anyway.
Well, yeah, I think we've concluded we need some more training.
Yeah.
You know?
Yes.
Yeah.
Yes.
And, yeah.
More training in healthcare.
Yeah.
And if you don't like your doctor, you don't like, just keep hunting
Keep
for them.
looking.
Check with parents like Heather did, right? You went
Mhm.
ask for resources.
Yeah, don't feel isolated. That's what I just thought. I'm just going to go to the people because the people know,
Right.
and they're not going to be afraid to tell you. You
Right.
can't call a practice manager and them say, "Yeah, such and such is," No, they're all going to be like, "This doctor's great,"
Right.
because So you've got to, and they might be great with other populations.
Right.
True.
I'm specifically wanting to know, are they good with the disability population? If they're not, then I'm just going to move on and try someone else. So
Right.
reaching out was definitely, I figured it out within a week after that, after I asked other parents that had older kids. So
Mm-hmm. Mm-hmm.
that's what I say. Keep reaching out and networking.
Yeah, that's for sure. That's for sure. Thank you for listening. Listen, we might have healthcare part 2. We might have think something else. Who knows?
Exactly.
Okay. For sure.
Okay, so you can listen to this podcast on Apple, Spotify, or on our website, navigatingadultautism.com. And we're on Facebook and Instagram on Navigating Adult Autism Podcast. And then if you want to contact us, it's moms@navigatingadultautism.com. Thank you.
Thank you.
Bye.
Bye.